Dr. Crayle, do you see children in your practice?
Oh, yes, we do. Absolutely.
Okay. Well, tell us a little bit about tell us, for instance, mom, let's assume we have a newborn, not a newborn mom, but we have a newborn child. We have a mom who is maybe the first time having a baby. Maybe she's a little nervous of where, when, what, how. When should she bring the kid to the dentist, and what would that entail? Is there anything she should know, do or not do with that young born in terms of, kind of have do the right thing for the teeth?
Right. Okay. Generally we start to see the children around 2 to 3 years old when they're able to sit in the chair and to talk and cooperate a little. But if the mother may notice any problems or has any questions about the teeth, the development of the teeth, or see spots on the teeth, anything like that, they're welcome to bring them in even sooner. We'd be glad to take a look at them, and we can deal with it at that point. What recommendations I would make is never put the child to bed with the bottle. You don't want the bottle to sit in the mouth for hours at a time, because that will certainly cause decay and problems.
That's kind of like instead of cleaning and brushing the teeth at night so that the sugar or the whatever is not sticking to the teeth and eats it up, that would be the opposite, would be soaking it in sugar, because milk, orange juice, anything except water, I think, will have some stuff in it which is not good for the teeth, probably, right?
Right. It has natural sugars in it, so you want to go easy on the milk and the juices, especially at night at bedtime.
Now, what work if a child comes in at 2.5, 3 years? What work do you do there? What work has to be done for the child?
Well, the first visit is usually just to introduce the child to the office, and the chair goes up and down, and the light turns on and off, and the little water and air squirters. And if the child is comfortable and cooperative, the mother or the father is free to be in the room there for encouragement. And if the child is comfortable with that, maybe we can show them how we polish the teeth, and we look at the teeth just to make sure that there are no problems, and we'll call it a successful visit.
I see. So it's getting the kid used to the dental office.
Right. And if they want to come in when mom has the visit, they can watch mom get the teeth cleaned or dad get the teeth cleaned, and that's a good experience too.
Got it. Now, in terms of brushing teeth, do the parents have to pay to start that right, as the first teeth are wrapped, or do they need to do something even before? And what's a good way of getting about to get that kid to brush? Any tips you have there?
Yes, well, to start cleaning the mouth at an early age on a regular basis is a good habit to start. You don't necessarily have to start with a toothbrush right away. You can just start with a soft cloth, a very soft children's washcloth, just gently massaging, rubbing the gums and the teeth a little bit, just to clean off whatever you can. They get them used to the idea of, yes, we have to clean the inside of the mouth, just like I wash my face and my hands. The mouth needs to be cleaned too.
Got it. Now, what importance do those first baby teeth have? There's sometimes, I remember, when I grew up, and I think everything seems to have been fine, but there was this, it's the baby teeth. So what? It comes out earlier, later. If it hurts, let's pull it out. Let's not fix it, because there's no reason to. It comes out in a year or two anyway. Is there something to that yes, the baby teeth are not all that important? Are they very important? Do they have a function? Should we make sure tell us all about it.
Right. Right. The baby teeth are very important to a child, just as the adult teeth are important to an adult. They come in at various times, but they're very important in the development of the jaw and of course, for eating, learning how to speak, and so forth. And the baby teeth are important to maintain them until they're ready to fall out naturally, because they do keep the space open for the new permanent teeth to come in.
Okay, so I see. So basically they need to be there to keep the space for the other teeth. Otherwise, the permanent teeth, they might, as you guys call it, crowd themselves. They might not come out straight, and that adds on to the orthodontic bill, or makes it necessary when otherwise it might not have been necessary. Is that what it is?
Right. They may come in crooked. They may not be able to come in at all. That's true.
Okay. All right. Okay. Thank you very much, Dr. Crayle.